Hello and welcome to Check 1 2, where we give you the lowdown on testicular cancer by talking to survivors, advocates and supporters of testicular cancer here at the world famous podcast studio Glasgow. Joining us for this conversation is Dr. Emeka Okorocha, a frontline doctor, health advocate and TV personality who's passionate about breaking down stigmas and encouraging men to take their health seriously. You might recognise him from his TV appearances, including when he performed a live testicular check on comedian Russell Kane on Steph's Packed Lunch, a moment that got people talking. We'll be discussing the signs and symptoms of testicular cancer, how to check yourself properly, and the risk factors every guy should know about. We'll also dive into why some men struggle to get taken seriously by their GPs, the disparities between awareness within the black community, and whether moments like the Russell Kane's live exam are helping to shift the conversation. This is a must-listen episode for every man and for anyone who cares about men's health. So, ladies and gentlemen, Dr. Emeka. Yeah, so just for people who might not know you, can you just give me a quick introduction to who you are and what you do?
Thanks. Well, I'm Dr. Emeka Okorocha. So I'm an NHS medical doctor. I'm also an author of the book Your Health in Your Hands. I'm also a television personality and social media health influencer. So I do a lot on TV about promoting health, as well as my social media platforms.
Yeah. And obviously, you done... Yeah. I think it was Steph's Packed Lunch. I think it was last year where they done a testicular cancer awareness, and one of our supporters had actually went down. It was featured on the show, but you'd done a live testicular check on comedian Russell Kane. How was that, performing that live on TV?
Yeah, it was a lot of fun because Russell's a very funny guy, but he's also very professional. It was interesting because obviously the genitals, especially the testicles, are very sensitive in a man, and you know how much you press and feel on your own and how that feels for you. However, how that feels to someone else might be very difficult, very different. So I didn't want to, put him in any pain or embarrassment on camera, but I also wanted to convey the message of how important it was and also show the technique of exactly what men should be doing when in and out of the shower, etc., and highlighting that. So it was a good experience. I think it was fun but educational.
No, it definitely was, and it came across so well on the show as well. So it was great to see that happening, especially us being a testicular cancer charity, to see the proper people, somebody speaking through the proper technique. And I suppose that's maybe the kind of the first thing we could talk about then is with testicular cancer. What are some of those early warning signs and how do men recognise them?
That's a very, very good question. So basically, testicular cancer is kind of what it says on the box. It's a type of cancer that originates in the testes, the testicles, which are the part of the male reproductive system, hence why it only affects men. It's relatively rare when you consider cancers in the UK, such as lung cancer, breast cancer, bowel cancer. But it's one of the most common cancers in young men between the ages 15 and 35. And that's why it's important for people like you and me to get on these platforms and talk about it. And one of the things is, it's actually also one of the most treatable cancers too, especially if you detect it early, and self-detection is really so important. So some of the early symptoms you want to be looking out for are a change in the testicles. So a painless lump or swelling is the most common sign. So, for example, most people will feel their testicles every now and then. You should, if you can, try and feel them every time you're in and out the shower. Just have a little feel. It doesn't take very long because the more you feel your own body, the quicker you'll notice if there's a change.
Yeah.
And obviously, the quicker you notice there's a change, you'll come see myself or one of my colleagues as a GP, notice and be like, "Hi, I'm sorry, doctor, I found this suspicious lump that's come up the last couple of days." And then we ourselves can ask you questions and examine it, refer you on, etc. You might also feel heaviness in the scrotum, or sometimes even a dull pain or ache, a deep ache in the scrotum without trauma in the abdomen or the groin. Or you might find that your testicles change in a size or shape or even texture. So any of these changes that are worrying, I think you definitely be checking in with a medical professional.
Yeah. And Are there any symptoms that people tend to overlook or mistake for something else?
You know what? Unfortunately, You can, but this is often when you've missed some of the earlier symptoms. So some of the advanced symptoms could be if you've actually developed testicular cancer and it's spread around the body. So you can develop severe back pain. So somebody could come in with back pain, not having noticed the change on their testicles, or shortness of breath or chest pain, because this could indicate that cancer spread to, the abdomen or the lungs perhaps, or even swelling in the legs if it's obstructed the lymphatic drainage. And this could obviously present in a number of different ways. And if you have miscellaneous back pain or chest pain or swelling in the legs, the first thing you're not thinking is, oh, do I have testicular cancer? So often could be misdiagnosed and misseen as something else, especially if you haven't told your health professional, oh, and prior to this, a few months earlier, a few weeks earlier, I actually had a bit of a change of shape in my testicles or whatever.
Yeah. And I think like that kind of leads into, like, you look at, Chris Stark has obviously just came out and talking about his testicular cancer diagnosis, the Capital One presenter, and him having a football injury, and he kind of put it off thinking it was just going to be that, and that's something else that can happen.
Exactly, and that's why it's missed. Like we said, testicular cancer, although rare, is very common in men of, I'm not sure how old you are, I don't want to guess, but very common in men of our age, and so early detection is key because it is one of the most treatable cancers. Obviously, we know by excision, radio and chemotherapy if necessary. But that's why we advise people to check. The same way I've been on campaigns and advised women to check their breasts, although I don't have, much breast tissue myself. I've advised women to check their breasts in which way they can, because detecting an early lump there can be just as useful and just as profitable as detecting a lump in your testicles.
Yeah, and obviously, because of the type of cancer that testicular cancer is, it being a kind of a germ cell cancer, in terms of kind of lifestyle choices and things like that, there isn't risk factors really in that regard. But there are some risk factors that they're talking about now, like undescended testicles and family history. Do they play a huge part in that then?
Yes, like you said, actually, which is something a lot of people overlook. It's a specific cancer where a lot of modifiable risk factors won't play a big part. So when you think about some of the bigger cancers in terms of lung cancer and smoking, and then liver cancer and drinking, a lot of them have these modifiable risk factors that you can do with your lifestyle changes to reduce your risk. Whereas with testicular cancer, and why it affects people generally younger, is because it has a lot more non-modifiable risk factors. And these basically means risk factors that you yourself can't change. You're kind of born with them or you're born without them. And so cryptorchidism, which, as you mentioned, is undescended testicles, are people who have had their testicles when they don't descend fully at birth. And so often we check these and we screen these. I've worked in pediatrics and we screen these on babies. And then they're screened quite a few times to make sure that these testicles have descended, because if not, this is quite easily reversible in young age. Also, if you've had a family history. So I would be relatively aware if you've had a family history, like a brother or father who's had testicular cancer at a younger age, this increases the risk. Your age, like I said, it mainly affects men between 15 and 35. And then we know there are other certain cancers which affect men later on, like prostate, for example, and they have their own risk factors and age groups. And then race and ethnicity is more common actually in Caucasian men than African American and Asian men. And obviously we have a massive demographic of Caucasian men here in the UK, which is why it obviously has an high incidence and prevalence. And then personal history, if you've had it before. So if you had testicular cancer in one testicle, unfortunately, the way life works, you might get it in the next one. And then there's certain genetic conditions that have a relatively low risk but can increase your overall risk, which I won't go into. And I think men who have previously suffered with HIV and AIDS may have a slightly higher risk, the evidence is showing. So, like I said, there's not much you could do for yourself in terms of lifestyle, but you can check, has anyone in your family had it? As in, did you have an undescended testicle at birth? Obviously, race, ethnicity, personal history, you'll know this yourselves, but yeah, that's what it really pretty much comes down to. Yeah.
And I think it's something as well that we're still in a time where, testicular cancer isn't spoken about quite as prevalently as most other cancers, and that's obviously because of the numbers aren't quite as big. But like you say, it predominantly affects these young men at the prime of their life. Is there a way that that we can try and change that stigma about it?
Well, I mean, you're doing a great job with what you're doing here with promoting testicular cancer. So credit to you guys up in Bonnie, Scotland, and what you're doing.
Cheers for that.
It's really important because, like you said, it doesn't really get as much airtime as some of the other cancers. And one of the big factors is this is kind of barn door. It only really affects men. And which demographic in terms of men and women are the least likely to speak up about their health? Men. When it comes to men's mental health, when it comes to men's physical health, as lads, as guys, we're typically not known for opening up about our bodies and our ailments because it's seen as a stigma, because it's seen as weak, because you don't want a random doctor like me touching your nuts in the clinic, which is understandable. But I think when men realize just how important it is and that it could be potentially life-saving or testicle-saving that way, then that's when it becomes obviously quite important. And I'm having younger men, like I've been working in GP and I have had younger men coming into the clinic with, I don't know, rectal bleeding and painful anus and, genital swelling and stuff that would normally be kind of embarrassing for a young guy in his 20s, 30s to come into and chat to the doctor, especially if the doctor is another young guy in his 20s, 30s, because not necessarily someone you want to talk to that about. But we are seeing it, more commonly presented. And obviously, like you mentioned, with Steph Pack Lunch and Russell Kane, who's obviously really, really relatable for young men, having people like that come forward and, go through the shame and embarrassment of having their own testicles felt on television, it kind of opens the doors for more people to come and be more open about it. So hopefully later down the line, stuff like this will just snowball in a spiral and we'll see more people coming forward.
Yeah. And like you say, if social media, unfortunately and fortunately, is king in this day and age. And when you've got shows like that, and when they're clipped down, and young men see, somebody else doing this, and and people obviously look up to Russell. If they're able to go, well, he's doing that, I should do that, and like you say, hopefully it snowballs down that in generations to come, it's just something that we do naturally, and that's what happens for us. Yeah,
exactly.
I don't know how often this is something that you've came across, but on the podcast, there's been some of our guests who, and this is obviously a lot of them in Scotland, who have went to their GP with their concerns, but there still seems to be like a kind of a bias or unconscious bias to it being nothing because the statistics are so low. What would you say to your fellow doctors and medical professionals in that regard?
It's good you notice that, because I think as medical professionals, we often tell patients how much they need to do in terms of more coming to see us, cutting down alcohol, stopping smoking, getting fit, watching the diet. Whereas we as clinicians can also do more to, be more receptive to patients. As in, it's not all the patient's fault. When I look at health, social behavior and why people go and see the doctor, it's not always about just the patient. It's about the doctor too. If you provide an environment where where somebody feels they're going to be listened to, taken seriously, and their concerns and needs are going to be met adequately, they're far more likely to visit you. And this is what we try to learn. And I think they are trying to encourage more teaching on the patient-doctor rapport approach. And we do actually get assessed on it now by our seniors in terms of how well the patient, and we do get feedback now from patients. So how well the patient enjoyed the conversation, or how much they think they were actually taken seriously, and how well they think their concerns were addressed. So to my colleagues, most of them will be actually on this because they'll need to if they want to progress to the next stage in training, because it's becoming requirements and something we're judged on based on this feedback that people don't think their concerns are met or that they feel like they're fobbed off. And in medicine, I've always said it's better to be safe than sorry.
Yeah.
Like we have, a bit, not huge, but we do have an NHS budget, and we have it for a reason. Like you should be ordering relevant tests and appropriate tests where you think, oh, this could be life-changing for this person, because I'd rather order an ultrasound of your testes and see that, oh, okay, it was just a fluid-filled cyst or whatnot and not potential cancer, than not order it thinking, oh, okay, you don't need to do that. I don't think it's really necessary. And then it turned out to be something a bit more sinister down the line. And the worst thing is you think actually the prognosis and outcome would have been far more favorable for the patient had I just done that investigation and test earlier when I should have. And as a general practitioner or a doctor in a hospital, you never want to have that feeling, and you definitely don't want to have that for your patient. So,
yeah. No, that's great, and it's always good when you can speak to somebody who works in your profession and who is a doctor who has that understanding, and you just hope that like these things are going forward, because at the end of the day, you know, doctors are human as well, and things might be missed, and or that there is definitely pressures in terms of how quickly you have to see a patient, especially in local practices, and we understand that. But it's if they can just take that, like you say, that approach of better being safe than sorry, I think it really will help.
Oh yeah, exactly that.
And you obviously see, like we talked about, you know, men are really, really bad at going to the doctors and talking about not only their physical health but their mental health. But you know, and when we see that fear or embarrassment in men, why is it important for these men to kind of try and push past that?
It's important because it's important for their health at the end of the day. As in, when it comes to medicine, any disease, whether it be mental health or physical health, that you've left for a long time after the date of presentation, the longer you leave it, the worse it's going to be. The longer you leave it, the harder it's going to be to treat. And so you're going to be maybe going through a chronic cycle of treatments for years or months that could have been resolved in one or two simple consultations and appointments had you come forward earlier. So it's for the patients themselves, and not only that, the strain on the NHS. For example, if you developed, let's say, a cancer, and you haven't gone to your GP with the symptoms because you didn't want to, you were scared or embarrassed, felt it was a waste of time, you were nonchalant, whatever, it's developed and spread. This is going to need more scans. There's going to need more blood tests. There's going to be more treatment. There's going to need more medication. All this is eventually cost on our NHS, rather than something that would have been identified from a simple blood test or simple scan and dealt with at the time. I probably would just need a follow-up every 6 months. That's going to be very different to now what you're going to have to go through, what the NHS is going to have to go through. So it's important on both ends of the spectrum, really, that patients do push past that barrier and do come forward.
Yeah, I think a lot of patients, and I was one of these, like when I found my lump, I left it again for about a month. I'd made an appointment and then put it off and thought, I'm just going to be wasting my GP's time. And I think that's the worry that a lot of people have, that they understand the pressures of being a GP as well as that as well, in terms of wasting time. And so what would you say to somebody who's maybe watching this, who maybe has a problem then, that, you know, that's maybe the thought that they're having?
I would say you're never wasting a GP's time. You'd rather the GP tell you, okay, this isn't necessary, you don't need to come in and see me. You'd rather that than not go at all. Trust me, as GPs, trainees, we're paid to be there for a reason. We're not paid but per patient. It's not like, okay, I'm going to get this much per patient, that much per patient. You're paid to see the patients who book in to see you, irrelevant to what their problem is. So you're never wasting GP's time, because we're going to be there anyway. Whether you come see us or not, we're still there. We still show up to work. You know what I mean? So you're better off getting yourself an appointment, because I know patients, and I would never say that patients are wasting my time. Even if I don't think that the patient's presentation was clinically appropriate, would I say? Like, you didn't necessarily need to see the GP from this. A part of an onus is on us as well, because we should be giving education to people in the public and saying when you should see your GP and when you don't necessarily need to. And these are the resources you can use, and where you don't need to see your GP. That's part of it from us, from health professionals. And that's a lot of the stuff that I do. It's to stop people coming in to see GPs and coming into coronary ambulances when necessarily they may not need to, and they could handle things themselves. But in many cases, you do need to see your GP, because even if it's just to calm your anxiety or nerves, a lot of people suffer with mental health and physical health at the same time. So if you've had a long-term chronic physical condition, you're at a higher percentage of it developing a mental health issue. So you could just be getting severe anxiety or having your anxiety flare up simply because you might think something's going on wrong with your body and you haven't had any clarification or any definitive answer of what it is or what it's not.
Yeah.
So even that itself can be beneficial for you going down the line. So it doesn't always need to be physical. You have to think laterally sometimes. And in many ways, that you should be going to see your GP.
Yeah, no, that's perfect. Yeah, and I think that kind of always falls in line with even the after effects of testicular cancer. I think it's one of the things that I've spoke about, more and more as I talk to more men, is that we can just have the testicular cancer diagnosis, then there's the treatment, but it's the mental health aspect of that afterwards as well, and it's looking after your own mental health and reaching out about that as well, because obviously body image is going to be a huge issue. If you've lost that testicle, if you've lost weight because of your chemo, and then the other bits and pieces that can happen. Is that something you've maybe came across in patients that you've seen? These kind of mental health stressors that happen after treatment's finished?
Yes, you do. As in anyone, because it's a level of trauma in a way. Just because you're not getting knocked with something doesn't mean it's trauma. Mm-hmm. We know we're very familiar with PTSD, post-traumatic stress disorder, when it comes to people who've been in the war or the army or witnessed a significant car crash when they're younger, etc. However, this happens with people who have faced disease, because for a lot of people, in your mind, you feel like you're on the brink of death. The minute you hear cancer, you hear death sentence. And a lot of people have been on the brink of death. And so you could be treated and you could be obviously undergoing surveillance. But, cancer, although often it's in remission, sometimes cancer can relapse. And so a lot of people will develop stress disorders and anxiety and sometimes even depression following the treatment, even if they've been physically, let's say, healed or treated. They might still mentally suffer from the side effects of what they've gone through, ultimately, because anyone who's gone through cancer and survived has gone through an experience, an ordeal. So it should be highlighted that that's quite a significant event in someone's life.
Yeah, oh, definitely. I think it's something that certainly that happened with me. Even from the start of my diagnosis to the end of my treatment, it was the one thing that I found, that it was actually at the end of it all that I went, oh my God, I've had cancer. You were told months before your treatment you had the surgery, but it was actually at the very end when you were in recovery almost that I sat and was like, oh, this has happened to me.
What?
And so yeah, it's
later.
Yeah. Obviously, having been working in television and promoting health and things like that in TV, how important is it for people like yourself to really kind of take that approach and be proactive in getting not just like the people in the UK, but specifically, when it comes to kind of men's health, as we don't talk about it, how important is it for you to try and get that information across?
Honestly, I think it's really important if you're that kind of person and you've been given that sort of platform. Now, I know it's not for everybody, and there are a lot of doctors and medics and health professionals who do a fantastic job in their fields who just don't have the personality to expose themselves on social media and television. And that's okay.
Yeah.
I wouldn't say you're less of a doctor or less of a health professional if you're not up for doing what I'm doing, because it just suits me. I'm a person, I like to talk. I'm a person, I'm very comfortable in front of the camera. Like, it doesn't faze me, and I have a platform. People do follow me, they listen to what I say. So it makes sense that ethically I have a moral responsibility to use my platform and use the fact that I can be in front of camera for good and show people, oh, actually, I can entertain and it can be good to watch me, but here, let me educate you on this, because this can change your life. This can help your life. This can help somebody in your family. So I think it's really important, and I feel a massive sense of importance when I do it. And I've been blessed and fortunate enough to be in this space, and that's why I kind of wrote the book, Your Health in Your Hands, because I just wanted to reach as many people as possible. Obviously, you'll see every patient that you see on a day-to-day basis, but thought, if I can actually reach the globe, reach the national population, even better. And I do have people comment and send in emails and send in DMs and say, oh, doctor, I saw you on XYZ. You said this and it actually saved my son from choking, that episode you did. And stuff like that really, really, really is rewarding, because I feel, wow, I don't even know this person personally. However, some of the information I've given has genuinely affected and touched his life more than I could ever understand. And how many other people are out there who've genuinely benefited from something that I've learned, that I've taught them, or I've educated them on. And so the more people do it, the more people are going to know. I think there are a number of rising health professionals on media, social media, and mainstream media today talking. Not all of them I'd agree with. Yeah. However, the majority, yes. And so it's one of these things that I think is going to become more and more common going down the line in the future.
Yeah. And how do you think that people then, when you touched on like the ones that you maybe don't agree with, how do people cut through the noise of medical disinformation and the right thing?
That's a very good question. First of all, you need to know the person you're listening to is legit. Are they governed by a regulated body like the General Medical Council, the GMC, the NMC, the Nursing Medical Council? Like, are they actually working as a licensed professional? I think that's kind of the first thing you want to see. Then you want to look at, okay, what's their background and what's their agenda? Why are they giving this information? Is it because they're specifically trying to sell you something? So because of that, does that mean everything they're saying is naturally factual, or is it impartial? Is it opinionated? Is it subjective? Is it objective? You want to have to ask your questions why you're seeing this information, where you're seeing it, and what their objective would be. So my objective would be for you to benefit your health, which is then going to take a play for you and for us working in the NHS and all the other patients, because it means we're just going to be seeing patients who actually need to be seen, which is my job and what I signed up for. So somebody could see that and be like, okay, he's giving me this information because he actually wants me to know it. So he's doing this podcast because he actually wants to spread awareness and information about testicular cancer. Whereas somebody else might be trying to sell you particular products and service. And there's nothing wrong with that, especially if the products and service is worked or it can benefit you. I have no problem with that. But you just need to be aware of what you're listening to and why you're listening to it. Yeah.
Especially when it comes to the health, it's such an important thing not to get wrong when you're listening to people's advice, isn't it? And the kind of real world impact that, people like yourself, coming on and talking about testicular cancer, for example, what impact do you think that has going forward, when there's more and more people starting to talk about it?
What impact do I think?
Coming on and speaking about testicular cancer has.
Oh, I think the impact is definitely major because, one, it creates awareness. Two, when you're hearing it from someone who's a health professional, you see they're enthusiastic and passionate about it, and then it kind of makes you feel it kind of reduces the stigma. I think the more people talk about something, the more the stigma is reduced. For example, and I don't even want to use this as the best example, but I don't know if you've heard of OnlyFans, the creator site.
Yeah.
It's a real thing where men and women who went on it and had an account, it was a stigma. You didn't want to associate with someone who had that account. They were seen as this type of person in this type of society, kind of frowned upon, kind of looked down upon. Whereas now, people, especially since there's been so much money made from it, people have talked about it so much, it's been so far over social media, it's made mainstream news now, that people are very, very proud to say they have it. People will promote it. People are making money from it. People use it as a full-time career, a money-making machine. Take that 3-4 years ago. If you were on it, you probably didn't tell anyone.
Yeah.
So that just shows you the difference about talking to something about something can do. Talking about testicular cancer, talking about prostate cancer, talking about breast cancer. It shows you just how significant it can be if we all just have a chat about it. And so because we know the main ones, the lungs, the bowel, breast cancer, prostate cancer, etc., we haven't really spoken about testicular cancer and other cancers that I personally am passionate about that we haven't really chatted about. So it's going to be a really interesting one going down the line. I think it's going to have a lot more impact where a lot more people like me have a bigger voice.
Yeah. And if you had the power to make one kind of major change in how we approach testicular cancer awareness and education, what would that be?
Very good question. You know what? I would like adverts, mainstream adverts and information to be at mainstream events such as football games, rugby games, the pub. I think I would target places where I know the affected demographic are going to be. So these are your pubs, your matches, your sports, your hangouts, all this kind of stuff. And I would like adverts. I mean, look, for a number of ethical reasons and financial reasons, they don't really have them. But I would like adverts. You're watching the Champions League final, then the adverts about checking your balls comes up. Yeah. That's what I want. because a lot of people are going to be like, wow, it's going to strike you. And obviously they do it a lot in America, where they push the narrative of stuff they want to advertise at big event shows such as the Super Bowl and the NBA finals and stuff like that. However, we don't do it as much here in the UK. And I think that would create so much more buzz about talking about it, and it'd create so much more buzz about people checking themselves and actually going in to see their GPs. And I think that would be huge. So if they ever come to me and be like, doctor, we want to do this testicular cancer advert about how to check yourself, and we want it to be played at the next FA Cup final, I'd be like, thank you.
Yeah, like, yes, this is what I want to do.
This is me. Right here.
And I think it would be impactful, especially when you look at football matches. Prime example, when Sebastian Haller made his return after having testicular cancer. Yeah. Imagine having that return plus the adverts during the game. It
was massive, and credit to him, because he returned to great form as well.
Yeah,
in terms of his play on the pitch. Unfortunately, I'm Nigerian, and Ivory Coast beat us in the final on their own soil. But what a credit and a story to him to come back with his country and win a major tournament in front of his home fans after recovering from cancer. I was like, that's massive and that's huge.
Yeah.
And it did spread such awareness on testicular cancer, because when you actually look at the prognosis, it's actually genuinely very good. Mm-hmm. If you had testicular cancer, just one testicle, and it's been identified early, you've had a orchiectomy and it's been removed, then you have like a 99% survival rate for at least 5 years.
Yeah.
And even when it spreads locally, you can have a 96% survival rate. So it's very, very treatable stuff if identified early. And that's why I say stuff like, if you can, search yourself, because that's the easiest way to kind of identify symptoms and signs.
Yeah. Like my boss Richie always says, he says we're taught from a very young age to look both ways before crossing the road, because it could potentially save your life. So checking your balls once a month, is much the same type of thing.
Yeah. Obviously, we advertise to check once a month. I'm checking almost every day, almost every other day.
Yeah.
Because it really doesn't take very much at all. Literally, you can really be checking, like you can notice a change within seconds. Mm-hmm. If you want to do a thorough examination, then yeah. But if you can notice a change within seconds, of yourself touching yourself, if you have a mirror as well, like me, and you're often in the mirror after you've come out, like when I, lotion myself up after the shower, whatever, I'm in the mirror. So anything that changes that I might not even feel, sometimes I could just see, and I'd be like, oh, that's not come there, because we often do that. And we talked about people who have certain types of skin. Mm-hmm. And are prone to developing certain types of skin cancer, because you won't necessarily feel anything. However, you might see something and be like, oh, that patch on my scalp, I've never noticed that.
Yeah.
And be surprised how many people come in. And it's often women, because women tend to be better at checking themselves and noticing a change in their physical appearance than men, because probably they take more time to look at themselves, and they're a bit more honed in on how they look. So they notice a physical appearance quicker than we do. But we need to get better as guys, checking ourselves and noticing the difference and getting diagnosed.
Yeah, and that's why I always say it's important. Like when I go out and I do talks and things like that, and sometimes I do it, and I'm starting to do it a lot at schools now, and you can sometimes see the kind of female members of the audience getting quite uncomfortable at the start. But I'm like, girls, you guys are so much better at this, and you even though you don't have testicles, you know somebody who does. So you are the driving force. And there's one of my friend's daughters, Sky Rose. She was at one of the schools when I was doing a talk there. And the first thing that Sky Rose done is she went straight back and told her dad, Paul's just been at the school doing the talk. Here's this leaflet, go and check your balls. And that's what you want. You want people just to be able to talk about it and go, no, you have to do this.
Exactly. So Paul told me, Dad, to get you to check your ball. That's hilarious. It's great. It's hilarious, but it's great. And we need more of it.
Yeah. And I think as well, it's like, what do you think the kind of the healthcare systems and doctors, that are doing these educational type things? Is there still a gap that you think exists in the education part of testicular cancer in terms of like schools and football clubs and things like that?
Yes, I do. It's difficult to say, because obviously I don't know exactly admittedly, I don't know exactly what they're teaching in PSHE and sex education around the country for different schools. I can only remember what I was taught, and then I can remember some of the campaigns I've been on, because I've actually done some teaching for kids and some PSHE classes. Some parents may recognize my voice because it was a cartoon based over COVID, where I was actually telling people and kids about first aid.
Right.
I what to do for it, bumps and lumps and burns on the playground. And funny enough, somebody did recognize it. You're that doctor that did that thing for my I was a teacher. And I was like, yeah, I did. And so I don't know exactly what's being taught, but from my knowledge, I don't think they're teaching many young boys about growing up and when to test for stuff like that. Obviously, we know that most of them are a little bit young in terms of the demographic if they're in their early teens. However, 15 onwards, like you're doing sex education, like we're teaching young men about safe sex and contraception.
Yeah.
And I do teach a little bit about STDs and STIs and what to look out for. We should be telling them about testicular cancer, because if you teach them young, they'll keep it on till they're old. Everyone knows that habits taught younger are more likely to last for a lifetime. As in, trust me, they develop habits. If you see how many of them at 15, 16, 17 are starting to vape and developing that as a habit that they continue on with, trust me, they can develop some good habits too.
Yeah. And that's so true. And I think when I go into schools, one of the biggest issues is maybe that they think that, that 15, 16-year-old, you sometimes maybe think the school have an opinion of their students and their maturity levels, where actually, I remember going into a school and the teacher was like, this lot coming in, I think they might be quite difficult. But the minute that I put the picture of me, bald, really gaunt, pale, and going, this was me in 2015, testicular cancer got me, you really see them kind of straighten up, and they got. And I don't think I've had a school where the boys, even though they've had the laughs and the jokes and the giggles, they've always been engaged. And I think it's trying to give our youth a little bit more credit to be health conscious, because I actually think this generation of kids coming up is way more health conscious than it would have been. I'm 40 now, so would have been way more health conscious and active in that than when I was at school.
Yeah, and you're right. And I think what you used there was a very good tactic, because it was like a relatable, almost fear shock tactic. And I think when it comes to guys, I feel like fear and shock tactics are the main thing that I see actually promotes change. Like when it comes to some of these old boys who've been smoking for 30, 40, 50 years, it's not until they've had a heart attack or a stroke, or they've seen someone very close to them who's been doing the exact same thing have a heart attack or a stroke, till they've been shocked in fear. And then it's that realization that, I need to do something, because if not, this could actually happen to me. Yeah. Like, it's out of sight, out of mind. Similar to what was going on, I think, with COVID back in the day, whereas if it wasn't affecting you or your family directly, you didn't kind of take much notice of it or think it was even real in some cases. Whereas the minute your family member dies from it, it's like a wake-up call. Actually, I need to wear a mask now, because now I'm scared. So, and I think that's kind of what you're doing there. And we do obviously have different ways in society we do that. I mean, those smoking packets, they put out the pictures of the lungs and all that kind of stuff. But I think we need to do it more. And it might just be me. I don't know if they're going to allow me on TikTok and Instagram to put some videos out of people, unfortunately, who've suffered from this, and be like, this could be you fellas. If you don't check these, unfortunately, this is why we're doing this. Yeah. As in, we're trying to keep you safe. As in, now you're normal, but 4 or 5 years, something could change. And you don't want this to be you, because you haven't taken the time to literally just check and see a GP. Yeah. No, and I think that would be a really powerful thing to do. Hopefully hopefully that's something that you can and will be allowed to do, As long as I'm within the guidelines, I guess, then hopefully it shouldn't be a problem. Yeah. I can't thank you enough for coming on Check 1 2 today, honestly. I think it's something that's needed, and when we see, doctors coming on to especially testicular cancer, like dedicated podcasts, it really does help spread that message. And because of the kind of platform that you have, hopefully, when this goes out, people pay attention and wake up to testicular health and understand that it's something that we need to,
talk about and educate about more and spread that awareness. And obviously, you know, just to recap at the end here, can you just do a quick kind of like what it is that, you know, quickly how to check and what you're looking for?
Yeah, thank you, man. I'm really, really glad you had me on the podcast, and hopefully people can get something from this. But some of the takeaway messages you want to know are that in young men, generally aged about 15 to 35, the most common way you're going to find primary testicular cancer is going to be a painless lump on your testicles. Any change on your testicles, please go and see a GP. Don't wait. Don't overthink it. Don't be too embarrassed. Please just book an appointment and go and see a GP. It's really treatable. If caught early, it could be life-changing. Polio will tell you it can be life-changing. The treatment options, there are a number of different options. Often, and now that there are even prosthesis, you know, because a lot of people were kind of concerned about the aesthetics of it. So regular self-check exams are the key to detection, guys. And please tell a friend, tell your brother, your father, your cousin, whoever, tell your mate, just get checked, get tested, check 1, 2.